Medic Mind. Motivate, mentor, maximize.
Here we will talk through the step-by-step process you need to take when answering questions in situational judgment. First off, let's start off by talking about should versus would. When you're answering UKCAT questions, never answer them based on how you yourself would react. This isn't a personality test or something that's trying to deduce how you'd instinctively react. Always try and use your intuition to decide the most appropriate action in a professional setting. For example, if you're given a non-medical setting, like a classroom, don't think of it from the viewpoint of a student at school. Instead, think using the medical principles of professionalism and integrity. Use these to respond accordingly. Approach a scenario logically and think, oh, what would a medical student do? What would your GP do? Our next tip is to ensure that you do not judge a response as if it is the only response that will occur. In one scenario, there are going to be about 4 or 5 different responses that you have per scenario. Don't look at the other responses when you're answering how to react to a response. We define a very appropriate thing to do as the optimal approach. But this doesn't mean that there is only one approach which is optimal. Let's have a look at an example of this. A GP wants to do a blood test. Now, there are several things he may need to do. He may need to ask the patient for consent. He may need to check the patient records for previous test results. He may need to calm the patient down if they're scared of needles. He may need to log the results on the patient's records. Or he may need to prescribe appropriate drugs dependent on the results. Now, each of these responses are all very appropriate things to do. If a scenario had each of these 5 responses, it would be perfectly normal to put A for each of them. Don't think, oh, if I put A for this one, I have to put B for this one. The UCAT doesn't work like that. Ensure you take each response independently. Now, let's talk about the 5 domains of response. When you read a response, don't see it as the only manner in which the medical student or doctor will respond. We can use 5 domains to categorize different possible responses. The first is mistake acknowledgement. Then we have documentation, clinical response, colleague communication, and patient communication. Now, a useful mnemonic to note here is my doctor can comfort patients. My doctor can comfort patients. MDCCP. An example now. So in this example, a medical student hears about a fellow medical student accidentally breaking confidentiality. These are the different responses that could occur. Mistake acknowledgement, acknowledging the mistake your colleague made and ensuring that he does not carry it out again by speaking to him. That would be a very appropriate thing to do. Writing down and recording the mistake that the medical student carried out is also a very appropriate thing to do. Ensuring that this breach of confidentiality does not affect the clinical diagnosis and prognosis of the patient is a very appropriate clinical response. Reporting the breach of confidentiality to the consultant is a very appropriate example of colleague communication. And lastly, communicating with the patient, especially if they had heard about the breach and are upset, is a very appropriate form of patient communication. Just to reiterate, do not try and compare different responses. As we've just shown, there could be a very large number of responses that could be a very appropriate thing to do. So that's one thing that you cannot do at all. Now, we've established that you should take each domain as a separate response, but for each of the 5 domains listed, the response in each domain should be taken as a very appropriate thing to do only if it fits the optimal approach in that individual domain. In other words, a very appropriate thing to do has to be the best possible response involving mistake acknowledgement, or documentation, or clinical response, or colleague communication, or patient communication. An example. A junior doctor makes a mistake. Whenever a junior doctor makes a mistake or a medical student makes a mistake, it is vital to apologize to the patient and reassure them of their safety. This will be a very appropriate thing to do. But in the same domain, if they immediately ask for consent to carry out the procedure again, This will be an inappropriate but not awful thing to do. Both of these responses come under the umbrella of patient communication, but can you see how one is an optimal approach and one is an inappropriate but not awful thing to do? This is why, in each domain, remember there is only one response that could be the optimal approach. Thank you for watching this free Medic Mind tutorial. For £30, you can unlock all 150 tutorials in our online course. The course covers 4 full days of UKCAT teaching, as well as a course to help you with your personal statement and interview. You're free to ask as many questions as you'd like to our teachers, and with each tutorial you can read along using our 5 UKCAT ebooks covering 500 pages of theory and questions to guide you every step of the way.